Thank you, Greg, and thank you, everyone. It's a great privilege for me to be here. I think this morning we heard about mostly retrospective real-world data, primarily from electronic health records and, to some extent, large claims databases, maybe also other databases. For this session, we will focus on the continuum of real-world data, especially the prospectively collected real-world data, be they the prospective observational studies or pragmatic interventional studies. And we will focus on two very broad questions. Number one would be around, is there a need for additional safety monitoring beyond what is instituted in routine clinical practice? That is to say, if we are conducting an interventional study, like a pragmatic clinical trial, are there special guidance or knowledge or experience that is required of the clinicians conducting the study that in order for them to adequately monitor the safety of the study participants? And then, distinct from that, but also somewhat related, is when does variation between comparison groups in our studies, in these interventional studies, real-world interventional studies, when does that represent a sort of a valid signal that requires us to study? When does variation and variability in between the comparison groups, between the characteristics of the comparison groups, represent a valid signal of interest, versus when does it represent really just noise that has to be adjusted away or explained away? I think these are the two. Again, it will depend on what's the question that we're asking, what is the research question that we're asking, but I think it requires some discussion from our panelists. I just realized that I began sort of giving some introductory remarks without introducing myself, which Amanda also asked me to specifically ask that before we make any comments that we'll introduce our names and who we are. So I'll retrospectively go back and introduce myself. So my name is Khaled Sarsour. I'm an epidemiologist and a lead scientist at Genetech, a real-world evidence group. We work across the continuum of drug development to derive real-world insights to help develop better drugs for patients and decision makers. So with that, in terms of our panelists, so Michael Horberg, who is of the Kaiser Permanente Mid-Atlantic Permanente Medical Group and the Executive Director of the Research Community Benefit and Medicaid Strategy, and also the Executive Director of the Mid-Atlantic Permanente Research Institute, will be talking to us about a specific example about safety monitoring of a study about lithium for suicide prevention. I'm sorry, so Michael Horberg is actually one of the discussants. And then Greg Simon and Robert Temple. Greg Simon, obviously, we know from this morning. And then Robert Temple, of the Deputy Director of Clinical Science at the Center for Drug Evaluation and Research at the U.S. Food and Drug Administration. Also, Ira Katz, who's a psychiatrist at the Corporal Michael J. Crescen's VA Medical Center in Philadelphia. He would actually be presenting to us about the suicide prevention lithium study. I think with that, I'd like to invite our panelists to come forward and begin the discussion.